If you're looking to open a drug and alcohol treatment center, one of the first and most important steps is state licensing, and it's also one of the most time-consuming and complex. Hi, I'm Adam Gutton, founder and managing partner of Behavioral Health Partners. My team and I have helped license over 80 treatment centers across the country, and in this video, I'm going to walk you through the licensing process, explain what's required, and highlight the common mistakes that can cost you months or even years of delays. Each state has its own regulations when it comes to licensing a rehab facility. Some states move quickly, while others have extensive application processes and long wait times. For example, in California, you can open a 6-bed residential facility with a relatively straightforward process, and we can do this in about 3 to 4 months. But if you want to have 7 or more beds, you need a special use permit, which can add significant time and complexity to your approval process. In New Jersey, the demand for treatment centers is so high that there's a waiting list for a new license. That means from the time you submit your application, it could take 18 to 24 months before you're even approved to operate. If you don't plan for this in advance, you could be stuck in limbo while your facility sits empty. This is why it's critical to understand your specific state's licensing requirements from the beginning. And that's exactly what we help our clients with, so they don't waste valuable time figuring it out the hard way. The state licensing process is detailed, and it's easy to get stuck at any stage. But in general, it comes down to 3 major steps. The first is zoning and location approval. Your facility must be in a properly zoned area, and different states have different rules on where you can open. Some states make this easy, while others require a special zoning permit or even a review by local government boards before you can operate. If you don't confirm zoning compliance before submitting your application, your facility could be ineligible from the start, leading to denied applications, resubmissions, and months, if not years of wasted time. Next, you'll need to complete your policies and procedures manual. This is a massive part of your licensing application and covers every aspect of your facility's operations, safety, and clinical care. Your policies need to be written in a way that's fully compliant with the state regulations, outlining everything from admissions procedures and client rights to staffing, medication management, and crisis response protocols. Many aspiring treatment center owners try to write these policies themselves, only to find out later that their documents don't meet state standards, leading to requests for revisions that can add months to the approval time. At Behavioral Health Partners, we've written dozens of state-compliant policies and procedures, allowing our clients to move through this stage smoothly and efficiently without unnecessary delays. Once your application is approved, the next step is the state facility inspection. Before you can begin operations, state officials will visit your facility to ensure that it meets all safety, staffing, and operational requirements. During this inspection, they'll evaluate the physical environment of your facility, including safety measures and compliance with building codes, your staffing requirements, including background checks, licensing, and credentialing of key personnel, your record-keeping processes, ensuring that all client documentation and treatment plans are in order. If there are any compliance issues, you may be required to correct them and schedule another inspection, which can push your opening date back by months. One of the biggest mistakes people make when applying for a state license is thinking they can figure it out as they go. The applications are long, detailed, and if you miss a requirement or need edits, it could add months, even years to your timeline. We've seen people submit applications without the right zoning approvals, complete and compliant policies and procedures, or required facility documentation, forcing them to start over and lose valuable time and money. That's why working with experts who have done this before can make all the difference. We know the common pitfalls and help you avoid them up front, so your facility can be licensed as quickly as possible. Right now, we're currently licensing facilities in 4 states, and by the time you're watching this, they are likely already operational because we don't waste time. Our team has navigated nearly every state's licensing process, and we make sure you get everything done right the first time, saving you months, if not years, of waiting. If you're serious about opening a rehab center, don't risk costly mistakes. Let's make sure your facility gets licensed quickly and efficiently so you can start helping people and make an impact. If you want to learn exactly what it takes to get licensed in your state, fill out the contact form on this page or click the link in the description of this video to schedule a free initial consultation with me or our team. We'll walk you through the specific requirements for your state, answer your questions, and help you create a licensing strategy that gets you to opening day as fast as possible. I look forward to helping you bring your vision to life. From Behavioral Health Partners, your trusted partner in growth and impact.